Hello, everyone. Good morning, good afternoon, and good evening. So nice to see many of you from different countries and different time zones. Wishing you all happy World Homeopathy Awareness Month. Before we start, we would thank Universe for giving us this great opportunity with Gayatri Mantra chanted by Professor Regina from Brazil.
Om Burvat Swaha Tat Savitur Varenyan Bargo Devasya Jimahi Jiyo Yo Na Prachodaya. Many blessings to the universe. Thank you. Back at you, Dr. Kavitha.
Thank you, Professor Regina. And welcome to Ka Homeopathy Study Group Pro Bono webinar hosted by Kavitha Holistic Approach. Few words about this study group. Ka's mission and vision are very unique to inspire young homeopaths, mentor, provide excellency for educational purposes using holistic approaches via webinars, which are based on principles of classical homeopathy and provide professional continuing educational homeopathic credits for practitioners. We provide merit certificates for spreading the light of homeopathy around the globe while celebrating stage 4 cancer survivors through our inspirational book talks. These webinars are for educational purposes only and see expert homeopath for treatment. This is Kavitha Kukunoor, board certified homeopath from Michigan, USA, President and CEO of Kavitha Holistic Approach, founder and director of Ka Homeopathy Study Group. I'm outreach coordinator of CHA PR committee, encouraging homeopaths to become CHA certified. As HNA CPD provider encourages homeopaths for HNA accredited CU webinars. I am a member of Kevin Friendly Foundation, a non-profit organization that helps to serve poor people in greater needs in India. I thank Ka Homeopathy Study Group entire team for the continuous support. This webinar is moderated by Ka family, Dr. Sweta Singh, Chief Administrator, and Professor Regina Rianelli. It is being recorded as we speak and we are live on Facebook. We will take questions at the end of the webinar. We will post jot form in Zoom chat at the end of the webinar. Please fill the form to receive the certificate of CU. Today, April 18th, 2021, and the webinar topic is Successful Management of Autism through Classical Homeopathy by Dr. Sujata Owens. It's a huge topic and we will cover as much as we can. Last week, I had a follow-up of my autistic child client, this boy who made great improvement, and he was given saccharum officinal, a sugar cane remedy. Based on symptoms, violent anger, capricious, bloated, peevish, and wants tidbits sugar, he's restless and associated with jealousy and sibling rivalry. And this case was posted in Homeopathy Today magazine. We know homeopathy helps for autism, ADD, ASD, when we give right remedy. That's the minimum. Following the principles of classical homeopathy, organ and philosophy as mentioned by Dr. Samuel Hahnemann. Today, we will learn more from Dr. Sujata Owens about treating autism through her experience. Dr. Sujata Owens is a renowned board-certified classical homeopath, first Indian homeopathic doctor to establish homeopathic practice in USA. She is a graduate and board medalist of DS Homeopathic Medical College from Pune, India. Sujata is a founding member and past president of Minnesota Homeopathic Association. She is a renowned international homeopathic practitioner with impeccable reputation and track record of successful cases. She is voted to be the best alternative practitioner in state of Minnesota. Sujata has done many video presentations for professional homeopathic community of Minnesota on topics such as autism, ADD, to name few, ADHD, multiple sclerosis, women's health, cancer, and many more. She has published articles, interviews, and written several book reviews in various publications, including The American Homeopath. She teaches at Northwestern Academy of Homeopathy, Minnesota, as an adjunct lecturer and is an yearly presenter at the Joint American Homeopathic Conference. It is so nice to meet Sujata Owens in next few days at JHA conference. And we met last year virtually and in person in 2018 at Phoenix. And at this JHC conference, Sujata Owens will speak about homeopathic support for the effects of stress in this pandemic crisis with her cases. So, to register, visit www.jhc.info, and registration to JHC ends on April 19th, which is tomorrow. So do not miss this great opportunity. And let us welcome Dr. Sujata Owens to our webinar.
Hello, everyone. Nice to be here. And I am excited and elated. I have to mention before we begin for Kavitha's this recognition of all her hard work through Martha Ullman Reward that will be presented to her on April 25th at Joint American Homeopathic Conference in 2021. Yay! Yay for Kavitha and her team. Congratulations.
That was a surprise for me. And before you start, since you have mentioned, I would like to take privilege to thank greatly NCH for honoring this prestigious award, and I'm dedicating this award to my dearest friend Debbie Brook, David Wackington, Dr. Vatsala, Professor Regina, Dr. Sweta Singh, and entire CAST study group team, and to my dear friends and to my prestigious Homeopathic Medical College JSPS. Thank you so much.
Cheers.
Congratulations, ma'am.
Thank you, Dr. Dr. Sujata, please, would you like to continue? And
Yes. Can I share my screen?
Yes, please. I think I made you the co-host, right?
Okay.
Yes, please.
Great. And I'm just going to go to the slideshow from the beginning. Okay. Everything looks good. So hello all. Welcome to thanks for your interest in autism and for giving the opportunity again for Kavitha a holistic study group and being here with you all. And this is an exciting topic because the miracles that happen with homeopathy are so amazing to see when we get the close match or similar mom in some cases, not most cases, in some cases. So that's what I'm going to talk about today. Let's begin. So what I thought is, so having practiced now for 34 years in Northfield, Minnesota is the state I have started my practice back in 1987. I thought that the having information in through successful cases and putting that in a data and I call it a data bank, and everyone participating to that, all the homeopaths from all over the world participating to that, I think will bring more credibility to homeopathy. So this is my contribution towards that bigger project. And since, again, there's more cases that I could write, but I decided to start with 5 cases that I have. And what I'm going to, my layout for today is just to actually not have you think about what remedy that necessarily I will be giving, because I'm going to put that through. I'm going to tell you how many years I have seen these kids. And so the oldest kid was 12 years old, and then the youngest was 4 years actually. Youngest was 4 years when I started seeing. And here's the cases, and then, I'll explore more with you through slides. So Jordan, I saw him when he was 6 years, very sensitive kid, just and present. So he was on the spectrum, diagnosed as autism, having IPE, the independent IEP, educational program, and all that, enrolled in that, definitely behind, but quite smart also, especially with his numbers and all that. And so I saw him for a year and 8 months, and his remedy throughout the time until he entered public school and started being in the normal classes was Belladonna. Case 2 is of Randy, and this was probably more serious autistic case of mine. Saw him only for 3 months, but even those 3 months, you will see how clear the change was and happened with Mercurius solubilis, and the remedy, that was the remedy I chose for him and gave him for, the entire 3 months, just single doses, Kentian way of prescribing. Third case is of Bobby. He's a 12 years kid, really much larger for his size, muscular, and I saw him for about 7 months. And the remedy that I gave him and started him actually on Laxodonta, which is the elephant's milk, and started him LM1. And then I will, as I talk about the case later on, you'll see how I managed the case through the LMs, and I did see the last homeopathic aggravation. So there's a lot of case management, dose, posology, potency, why particular one, that, I mean, we can have discussion on this for an entire day, basically. But we will do the best with the time Kavitha and the study group has offered us. James, it was 4 years when I saw him about 3 years, and actually now he is 12 years, and now he has returned just a few months back. And the remedy that during the time that I saw him back in 2011 through 2014 was borax 200C. And last case, this is, so out of 5 cases I'm presenting today, 4 are boys and 1 is a girl. And again, I continue to see Anne, and she has turned out to be exceptionally gifted, normal school, just amazing response to argon every time. I mean, she still needs a dose of argon 200C maybe once a year or less, but every time we give it to her, her symptoms just amazingly, you see the difference between what happens. Just wanted to let you know, if you have any questions or if you want to look at the PowerPoint presentation, today's presentation, you're certainly most welcome to go on my website, vitalforceconsulting.com. And also, if you have questions, feel free to email them to me at vitalforceconsulting4@gmail.com. Here's just the graphic presentation, belladonna, mercurius, elephant's milk, borax, and argon. Just to reintroduce and talk about these cases, each case was approached with classical homeopathy, and perceiving the case well, observations, listening to the parents, expressions of the child, all were important in figuring out what remedy was given in the end. And I will be showing the repertorization. So you can see out of 5 cases, there will be 3 cases that were repertorized: belladonna, mercurius solubilis, and borax. But the 2 cases, argon and Laxodonta, don't have that much information. So these are not as well represented in the repertory, being newer remedies. And so matching the essence was the method that was used. This is where all 5 cases, what ended up happening is parents were extremely happy with improvements because they saw their child go back to the normal school child experience and without IEPs, showed improvement in academic, social, and behavioral issues. Both centesimal and LM potencies were equally effective. All 5 cases showed noticeable improvement within actually a month after remedy dose, and then continued over time. So chronic remedy needed to be repeated during the course of the treatment. 4 out of 5 children were susceptible to getting acutes and showed clear immediate improvement with well-chosen acute remedy. And those remedies were bryonia, Ententard, spongia, calibichromicum. You probably, all the homeopaths, as homeopaths, we know the action of these remedies and what we give them for. And then I might touch base a little bit as we go along about that, and I'll answer any questions. 3 out of 5 children had eczema that resolved over course of treatment. 3 out of 5 children were exposed to drugs in the womb and after birth. And the reason for mentioning some of these things, this is not necessarily new findings, but we do find more susceptibilities for eczema, for gastric sensitivities, people who have been, the moms who have been taking drugs or antidepressants. There's a connection to autism. And also it's more observed in male children than female children. And that's all succinct in my observations through these 5 cases and actually my clinical practice cases too. And mother's state during pregnancy. So children's cases, we do know that mother's state is important during the pregnancy, and that also revealed the information that supported the choice of remedy. So totality of symptoms, the holistic way, the classical homeopathy just, is a phenomenal tool we have for the epidemic of autism that we're seeing now in so many children. And it's heartbreaking to see parents suffer through that, and our information that homeopathy can help needs to get out there. Also just touch base on after acute remedies, what I talked about is intercurrent remedy protocol. So 2 of the 5 children did need intercurrent remedies, miasm, and those were the no source. Miasms were kept in mind before selecting the remedy. And what I observed was less acutes came through once we used chronic remedy. And I call chronic remedy is a better word than constitutional remedy, because constitutional remedy, as the Constitution doesn't change, constitutional remedy never changes. And I want to stay open to possibility of something else coming up. So the chronic remedies also help, but after intercurrent remedies, I saw more vitality, less acutes, and the remedies that intercurrent remedies, 2 were meteorinum and basilinum, the no source, and then Morgan compound was used for bowel noser, was used in argon case. I'm giving you a lot of information on the front end, but this is going to all click as you see the cases as we move forward. A few other things about autism to understand role of vaccinations, gastrointestinal sensitivity, and now I'm going to comment a little bit on that. So each child had received vaccinations, and parents claimed that yes, the autism symptoms they thought were related to the vaccination damage. Gastrointestinal sensitivity was observed in all the children, and noticeable improvements came with the diet change to gluten-free, sugar-free, dairy-free diet. Taking clues from what was being communicated by the child was also helpful, especially in the Belladonna case, where he kept on going to Amy Lansky's book on impossible cure. So that was very interesting. So without further delay, with all this information I've given you, I would like to start with the case. Jordan was 6 years old when he came. Background information that was extremely important in his case was trauma. So the mom actually had episode. She has asthma, was on medications. She actually started seeing me after Jordan started getting better, but there were various issues at the birth, history of lots of medications for the child as well as for the mom. And then he was a very, very, very colicky child. Symptoms were extreme temper tantrums, pandas episodes, screaming, shrilling, banging, loud music on all radios, and night terror, photophobia, which is sensitivity to light. He actually would shut the lights off when he would come in the office and leave the lights off. Fear of dogs, repetitive behaviors, and his obsessions and fixations on certain numbers. And then also he liked to sing in tunes. Very, very sensitive and incredibly a kid that you could really resonate with and connect with. That was the case with Jordan, not every kid, but definitely Jordan. Um, in the history, there was tooth rest. So he had asthma as well as he had tooth restoration surgery that was enormous. I think they pulled all the teeth, and this was at 19 months. The asthma began after all the medications that he received for the tooth restoration. The autism diagnosis actually came when he was 3 years old. He had various strep related issues and he was diagnosed as a strep carrier. Sweet child, um, symptoms of the asthma and all that began, the pace was very rapid. That's another thing we look for when we're kind of, keeping in mind my asthmatic background. So it's a rapid pace. Those things came suddenly. His temper tantrums came suddenly. Pandas would begin suddenly. So there was this, suddenness seen, like Rajan Sankaran, Dr. Sankaran calls it, local becomes general. So when you see the same pattern come through various times during the course of the treatment, during when you're treating and the client is describing all the information, that's called local becomes general and becomes in the hierarchy of the symptoms gets more importance. Sympathetic nervous system activation in both mom and at birth. And so what happened with mom was she was stopped by the police when she was coming home. She's a botanist and worked in a botany lab. She was rushing home, must have been speeding a little bit, didn't realize she was, but basically she needed her inhaler or some asthma drug that she was due and had forgotten to bring it to work. And so anyway, the police stopped her, and even though she's telling them I have asthma, and she's of course pregnant, 7 months pregnant at that time, the police did still took her to the station. I mean, it was just not a good situation at all. Anyway, what she was telling the police is, I just need to go home, take a shower, and then take my meds. But they would not listen to her. So this whole sympathetic nervous system activation was seen also at the same time at birth. He was not. He had became blue, and APGAR score was very low, and so there was this whole issue of people, the chaos and the doctors being worried and nurses and shuttling and taking him away from the mom and all that. What I saw in the office though is he changed from really being sweet and calm to this like more wild behavior. And then when mom was describing his symptoms with the pandas and all that, she would say, I don't know what happens to him, but things just completely change. And he goes into, we don't know what the trigger is, but he immediately goes into having huge panda episodes. Quality of temper tantrums, definitely, and the pandas, we would call it violent, unpredictable, and sudden. Photophobia, by shutting the lights off. He never wore sunglasses or anything in the office, but definitely we saw him coming and shutting the light off. Night terrors and petrified of dogs. Those were other symptoms. The number 87 was very important. I think there is a character Rooney in one other YouTube or something that he had to hear over and over again. Doodle bops. His watch was extremely important to him, and he would continuously, like mom and I would be talking, and he would be in the office playing with some other toys there, and he would say, oh, it is 3 minutes to 9. So the numbers and all that was very, very important. The other thing he was obsessed about was my timer. I have a little um, timer that I keep. Now I don't have to because of the smartphones, but at that time, at least I had the timer. And he would always want to look at the numbers, play with the numbers, stop the timer, start the timer. So that was definitely seen with his, fixations on certain things. Repetitive behaviors, severe tooth decay leading to the dental surgery, as I mentioned in the history for 19 months, asthma since waking from anesthesia after a dental procedure. And then he also had lots of croupy cough that led to the emergency room visits. And then he would go, and the only book he would pull out, and I have like 4 or 5 different bookcases in the office, and he would pull out the Impossible Cure book. It's almost like he was trying to tell us something, and why he, and it's, as you know, the book is actually just information. There's no pictures or anything. So it wasn't even like children's book for a 6-year-old to be interested in, but this is the book that he pulled out every time. Here's the list of the drugs. I thought it would be good to see what he was exposed to. In utero, there was terbutaline, morphine, antibiotics, antihistamines, and flu shot. After birth, he received epinephrine, cortisone, injectable, as well as cream, albuterol, Mylicon, Tylenol, ibuprofen, amoxicillin, Zithromax, and Tylenol codeine. Here's his doodle or drawing, one of the drawings. He did multiple of them, but you can see the numbers. You see the third number 35. You see number 222, 122. So today this looks like a 5. It gives you the idea of the clutter that's going on in his brain. Now here's my repertorization. So I took some of, we tried to take the symptoms of what we find are important characteristics and things that we want to make sure that the remedy is in them. So this is from Red R Opus, Synthesis Repertory. And I took fear of dogs. I took photophobia. I took violent rage, shrieking in children, monomania, that's fixations and obsessions.
Agitated or
Yeah, I would just, whoever is not muted, please mute yourself. Thank you. And then the pace of the symptoms is sudden. So I took general manifestations, sudden. And so you can see the remedies that come up, and no surprise, right? Belladonna, hyoscyamus, veratrum, cuprum, stramonium. Now, in this particular repertorization, belladonna comes up first, but even if it was 4th or 5th, the process that happens after you choose the characteristic symptoms is to look at the materia medica and see which one comes matching. Now, tarantula, because he liked loud music in his pandas, was also one of the possibilities that I considered. But what was really characteristic to me, like sudden change from this sweet child to this very wild child. And I decided to that was the clincher for me for belladonna. Also, there's a few more things that I added: delirium violent, breaking things, capriciousness, and then obstinacy, that, just fixation and obstinacy, that once he fixed his mind on something, he'll just go to that. And there again, no surprise in the repertorization. You'll see belladonna, hyoscyamus, stramonium, apis comes up on this. And then another one that one could say was a differential diagnosis was tuberculinum, also along with tarantula. So I gave him belladonna 200C, single dose, and here's his remedy, first follow-up remedy response. And because the cases were, seen over a year, I'm not going, and because I want to present more cases, I'm just accumulating some of the remedy responses together. So he's somewhere along 2-3 months down the road, mom said, he now sits calmly, pays attention, follows direction, and he self-regulates outbursts. So at that point, he was still having outbursts, but he was able to self-regulate them, which I thought was an amazing sign. He also, in terms of his accomplishments, so he was in an IEP program and a therapy center, And from that, he started going to the school. And then he started attending public school. So I, not too many doses, maybe as needed. Once the client is understands what's happening and how to give the doses. There were no asthma. He was a strep carrier. That was actually another thing that was also went more towards belladonna. So you can see overall, the belladonna was an amazing prescription for this kid. And he responded very, very well. And the last time I saw him was when he actually moved to about an hour away, a town about an hour away from my hometown where I practice, and started attending public school. All right, so this is, I would love to take more questions, and then we will do towards the end so that I will have enough time to cover each case. So Randy is a Chinese boy. He was 9 years old. I have two colleges in my town, and his mom was one of the professors at the school, at one of the colleges. So Chinese immigrant family. And it was very interesting how scared, what I observed the first visit, the mother and Randy's older sister, there were just two kids, older sister and Randy, were extremely scared of the father, and the fear was actually palpable for me. What was also happening that father did not want the child to come and be seen by a homeopath, and he himself had schizophrenia. So family of the father also had Chinese persecution, put in the prison, and schizophrenia. So there is a huge trauma in the family genetics there. Mom actually felt persecuted by the father. And she actually told me that she thinks that the father outside my office is not in the hallway, but on the street, going up and down, stalking her. The grandfather died in the prison. And what I observed was this, Randy came rushing in and out. So I have 4 rooms at that time I had 4 rooms for my clinic, and he would come rushing in and out, always pick up this board game and checkers, and throw all the chips up. They would be scattered on the floor, pull them up, and then throw them again. This he did nonstop for the entire time. And when he wasn't doing that, he was either running to leave the office, go to the reception room, come fast back in. So, that was the whole restlessness that I was observing in this kid, with a lot of activity going on. And his mom also said that he has no sense of danger, and he can just go to the swimming pool. He can start just wandering. He can go in the street. He will start, doing all kinds of things that show fearlessness on his part. Extreme mood swings also were observed. There was also other things like profuse sweating, violence. And what was interesting in the mom's description when I was asking her about her pregnancy, so she kept on saying that how heavy her brain felt. That was one of the very important symptoms she kept on talking about. So here are the themes of the case. Moves like a toy clock is how mom described it. Very restless, and he moves like a toy clock. He loves nuts, and she said our family, our 3 generations cannot tolerate soft food, but love hard food. All the kids in the neighborhood who got vaccinated got diagnosed with autism, which was extremely important information, because what's happening here is they were in North Carolina before they moved to Minnesota, And there were, she said, in the neighborhood, 5 different families, they went to the same clinic. The boys were of the similar age, the kids were of the similar age. They all went to the clinic, they got vaccinated, and each one of the kids, 5 kids, came back with diagnosis of autism, which is, so again, information like this, I feel I cannot ignore. So the vaccination damage was definitely, in this case, was a symptom I would take. Earlier on when I was presenting, I was saying that, the parents thought vaccination played a big role. But when I see something like this, to me, yes, this is vaccination damage related to and the autism coming afterwards. This kid did not speak until 6, and when I saw him, difference between um, other kids who were actually speaking, Randy did not speak at all. He was just guttural sound would come up, like, so mom introduced him to me. Okay, this is Dr. Sujata, and we're going to go in the clinic, which was great, all that information. So say hi to Dr. Sujata, and he's like, oh, so like guttural sounds came. There was nothing you can even say that there was a hi. Mom was describing, here is a professor at the college, at the very Ivy League liberal arts college, and she's saying homework is so hard for him, requires drilling. His brain is dull, heavy, and numb, which is very interesting. These are the sensation words, so they're of course carrying much more weight. And mother described that her head feels very heavy, and did feel like that in pregnancy also. Mood swings and violence and attacking, biting, and also so sometimes this extreme, then the other times he's mild. And then I did observe this also, but mom also talked about he bursts out laughing involuntarily, and then it could be followed by crying, or just like that, crying happens involuntarily also. No sense of danger, and definitely gastrointestinal sensitivities. So here's the whole thing of checkers and going out, coming back, ritualistic behavior, monomania, no sense of danger. With the, he didn't say he felt persecuted, but mom talked about that. So delusion, persecuted, definitely morbid impulse and violence to do. And again, this is radar repertory and synthesis repertorization. He was worse in the night, restlessness, driving about. We saw inconstancy actually. And then I did take vaccinations elements after. With the GI sensitivity issues, allergic constitution, biting, and actually violence, morbid violence to do, biting, hitting, all those things. And then desires nuts. So the remedies that come up in our repertorization are sulfur, mercurius, arsenicum, iodine, belladonna, calcarea, stramonium. So the remedy I gave him was mercurius solubilis, the one that comes second. And because all the themes and all the symptoms I have mentioned. So Randy did not stay in the homeopathic protocol as much as I would have liked to, and I think partially it might have to do with his dad, and I'll talk about that in a minute. But nonetheless, the response was amazingly dramatic. So Randy is less hyper. He makes fewer throaty sounds. So because these throaty sounds, and what used to happen, like every time he would make that throaty sound, the dad would get triggered and his violence would go up, and he just could not stand that his son was not able to talk. And so there was all this dynamics in the family that was very dysfunctional. before the remedy. Less temper tantrums, less aggressive behavior. And because some of these throaty sounds got better, he started smiling a little bit more, the temper tantrums got less. What actually happened is his dad started bonding with Randy, and he ended up, they would have dates of cooking together, and he looks and feels happier. He smiles a lot. And then this is what mom described in the first follow-up. He's more calm, he's more focused, more affectionate. And actually, my friends are saying he looks normal. He's more intellectually active. So still the hard work and drilling for the at the time of the homework didn't go away, but it was definitely less. He still feels unsettled, and he needs to be busy. So good response. Then what happened was, so he came in for the first follow-up. He came in for the second follow-up. So this is about 3 months at the period. The second follow-up, his mom said, he's so much better that I would like to actually not continue homeopathy. So at that time, I did give her a few doses to bring along just to have on hand and use that because I knew there was no way to convince her. The fear of the father was still very palpable, and I didn't want to put the family in jeopardy, and they were happy. And actually at that time I thought maybe when the doses are gone and if the family sees that he needs to be on the remedy, they will come back. Well, now after 10 years, 11 years actually, just last spring, I got a call from a mom. You cured my son of autism, but his violent behavior is getting out of hand and he's actually hitting and now he's a 17-year-old, strong kid. Would you treat him? And because he was abusive at home, I mentioned to the mom that I will need, because of the abuse, and as a professional homeopath in the US, I will actually need to, if I start seeing him, I will need to report to the social services. And mom got really mad at me for saying that. At the same time, I have to, ethically, I'm practicing homeopathy in the US. And so I needed to keep with my idea that, if he's abusive as a practitioner, I will need to report. So he didn't come, but even at 17, her calling and saying, you cured him of autism, but the schizophrenia or the violence, that piece is coming back, and I would like to bring him back, was a testimonial enough to say that the autism piece was really handled well, even though I saw him only twice. Okay, so the third case is Bobby, and he is the oldest of the autism kids I've seen. I think after age 12, maybe we have to go into the teens, and these are all the 5 cases are under 12. So, so as I mentioned, Bobby was more muscular. He was even, I would say, when mom said he's 12 years old, I would have easily passed him as a 16-year-old or so. So this was an interesting situation. His stepmom, before coming in for the appointment, she and I had long conversations, and she was the caring mother at this point in his life, the maternal figure, and very concerned. And she gave the whole history of this child, who she became a mother of this child when he was, I think, 4 or 5. I think I might have that written somewhere further along. But the divorce from Bobby's mom was very, very, was not good, was a hard divorce. And Bobby has three other sisters. So all four of the kids were affected. And I will say, thank God that the stepmother came into picture because of all the abuse and neglect and dysfunction that was happening with his biological mom. So this is what the stepmom tells me. Bobby's father, he's a mechanical engineer and a crane operator. He handles huge, big machines and he has to, all the construction sites, and he has to make sure that everything is exact for the crane to operate. He has his crew underneath, and he's a very responsible guy, but he basically not home as much. He's, working at the construction site. Bobby was definitely devastated by the divorce, and the biological mother is a very neglecting person. And through the history, I'm going to tell you about what used to happen. Whereas the stepmom is the very caring, protective mom. The symptoms and observations, as I said, larger size, aggressive behavior. So for a while, he was put into institution. The things were that hard, and that's where they observed a lot of aggressive behaviors. Since stepmom has come into picture, and because of her caring and love, that's what's very obvious. The neglect, so his behavior was not aggressive. So I never saw him aggressive in the office. What I did see is he would go to my entertainment center. I have a TV, a VCR, and he would take out the DVD of Dumbo, and he would ask if he could put that. He would ask to his stepmom, and then stepmom said, well, you have to ask Dr. Owens. And then he'll say, kind of make gestures and kind of try to talk. And it was his, not that he was as affected as Randy, but definitely the speech was definitely not great speech. I mean, you could see if he started to talk, you could see that there's some issues here. He communicates through sound and through actually twirling. So his mom said, if I gave him my scarf, she had a scarf on, and I can keep him occupied, because he would twirl continuously the scarf. And it was almost like the idea of, if we look at, because the name of the remedy, lac-loxodonta, is the movement of the trunk. That was very calming for him. And he also was obsessive, but he was obsessive towards three things: good, evil, and death. And that came up from the movies he watches and the movies he likes. Here's the Bobby story as told by the stepmom. She, meaning Bobby's biological mom, put him on antipsychotic meds and trazodone. She mixed meds without concern. His room was in the basement. He was left there. He was given 2 bottles in the night. And this biological mom comes from a wealthy family. She came into the money, divorced his dad, and it was a very hard and traumatic divorce for everyone, for father and all the 4 kids. So the story is the basement, the kids, even when they were younger, Bobby, when he was younger, they were given medications, God knows which ones, many times left in the basement, bottles of food on the floor. They would forage like in the forest for the foods, and basically abuse and neglect through and through. How these kids survived is a really interesting phenomenon. survival of the fittest, I suppose. So he was institutionalized for attacking others with scissors, ripping up carpet. So what happened was he escaped. He tried to escape. And remember, Bobby is kind of a little bit on the larger size. And he escaped and went into an old lady's house and got into her bed and covered himself. Of course, he was scared. And that's the time that when the social services or institutional people came to find him, he tried to attack them and he was ripping up carpets and he was very belligerent. Also, according to stepmom, he's an extremely sensitive child and he could twirl a scarf all day if he was allowed. And that's a way of him calming. So she doesn't allow that as she's trying to reduce him doing these calming things. And he shuts down. He behaves, even at 12, he behaved like a 2-year-old. And then also shows repetitive behaviors. He loves to be sedentary, loves to snuggle. So he's a kid who just touch and affection was important to him. So he, as I said, he watched Dumbo not only the entire time after asking my permission, he watched when he was there for the first session, other than when his stepmom would call him and ask him to come and sit in the chair. He was watching the Dumbo movie. He likes Disney movies and he likes where the mother is dying or dead or trapped. Very, very interesting what kids try to convey by what they're watching. He likes stories with dungeons, fighting, evil, when good and bad are in the clash. And the way stepmom said she knows, because he would burst out laughing and things like he laughs hysterically when the witch dies in The Wizard of Oz. His favorite character is Cruella de Vil from the 101 Dalmatians. He relishes the high drama parts and memorizes them. I mean, he knows because he watched repetitively, he knows them. And then he chose to watch Dumbo from various DVDs that I have in the entertainment center. Here's the description of the stepmom. Bobby is like a gentle giant, picture of nobility. He is so faithful that he waits for his mom's red truck for hours on our driveway. So mom has visiting hours that she gets with Bobby and she drives the red truck. So when it's her day to pick him up, he's out there waiting for hours on the driveway for her to come. And unfortunately, most of the time, the mom doesn't show up. He has a habit of foraging and eating plants. So he'll actually go as if it's in the forest and eat off of the floor. And the stepmom said that's because that's how the food was left in the basement when he started crawling and all that. He loves swimming and any kind of water play. So he enjoys swimming. He brings his swimming trunk, puts on his swimming trunk and brings stepmom's swimming trunks to her and said, okay, we're swimming dress, swimming suit. And says, okay, it's time to go. So that's how it indicates that he wants to go and gets excited. He likes to go on the rides at the Mega Mall in Bloomington. And those are his happy days. He still has a strong need for affection. He loves to cuddle. And some of the things that he was doing was, flapping noises, hooting noises. So these are his stims and twirling. So as I said, the stepmom came into picture around 5, but until then, there is a lot of neglect, abuse, cruelty, and trauma for the kid. At age 5, came under care of the stepmom. And stepmom versus mother, in the animal kingdom remedies, we see this. And again, this is the state of a stepmom, but still she was so much energetically connected and in attune with this kid that I could take that as a larger picture of what's going on. So She was, she never took the stepmom's, the biological mom's name. She always referred to him as a she. Um, yeah, and or her, never taking her name. Now, Dad did not play active role in Bobby's healing journey. He was very much fine with stepmom taking charge and doing what needed to be do. What he was doing was just handling heavy equipment. And so you can see all these things. When we know elephants in the nature, you start seeing the things that match. And that's what happened to me. Like every place, his watching movie Dumbo, his description of the twirling, his dad's patriarchal lineage being much more mild, passive, but carrying these heavy equipments and the heavy responsibility, and the maternal mom playing much more role in the taking care of, the stepmom playing much bigger role in the caregiving. And that's the matriarchal lineage of the elephants, where the moms are the bosses, basically. So because of, the elephant's milk was obvious, there's no repertorization. I knew, and I'd seen the cases of lac-loxodonta. Nancy Herrick did a beautiful proving, and it's the proving, I had also read the proving. And so that's what I gave him. And I started him on LM because I just was little, wanted to be a little cautious, and with all the history of the medications and his sensitivity, just don't know, felt like I don't want to start too high. I'm easier if there's any aggravations that happen, then I can manage them easily. So I started him with LM1. I give them it's a 1/4 ounce droppered vial. They suckus it 10 times, put 5 drops into a 1/2 cup of the best drinking water. I say distilled water, but reverse osmosis works. Stir it 10 times, and they take 1 teaspoon. And every day they make a new solution until the entire LM bottle is completely used up. So I saw him for about, I think, 8 months or something like that, 7, 8 months. And during this time, so I, gave him, this was his baseline, started LM1. I started seeing improvement until end of LM4. So the first 3-4 months, things were, his the place that he was going for a school, at a school, he used to be very mischievous, not listen. Whereas what started happening as he was progressing through taking the remedy and LMs, and seeing me for the follow-ups, the teachers started giving him more free time and less one-on-one continuous looking at exactly what's happening in his case. So they call it giving him a longer leash, maybe more freedom time, more time he could choose what he wants to do because he was listening, learning, finishing his homework. At about 7-month time or so, at the LM4, he would take a dose and there would be worsening. So worsening of, again, not listening, trying to be more mischievous, more naughty, more not following the rules, disobedience. And so I didn't realize that this could be the last homeopathic aggravation. So I continued him. When we came, it wasn't terrible. He was still okay. So I'm like, I wonder if we have hit the rough patch. I was thinking how to manage it. But when he came for a follow-up after LM5, and things were, now you can see there is more, less improvement and more going downhill, I asked her to stop LM5 and let's see what happens. Within 3 days after stopping LM5, mom said he's better, then his improvement continued. So my last time I saw Bobby and Bobby's stepmom for him, I told her to just, she had a whole bottle of LM5 on hand still. I mean, she had used some, but still quite a bit, 2/3 of the bottle on hand. So I said, well, just let me know if symptoms return, and there's no need to do the follow-up at this point because we don't know how well he's going to be. So she stopped the LM5, and I never heard back from her because he continued to do well. So this is the responses that we see with the Lac-Loxodonta. So now Bobby started intentionally knowing who the people are and showing more outward behaviors like he wants to be with. Then he goes and runs. He's given much more freedom at school. He smiles a lot more, and he still loves going to swimming. And the cognitive improvements we saw were in the speech, in the writing, in the attention focus, correlating concepts, character recognition, decision making, and his sleep improved. So all these things, being able to know when to stay quiet, when is a playtime, all these things that as the kids learn, autistic kids have a little difficulty and they might be late in understanding these things. So how to be in a social situation and how to adapt and how to, still do your homework and focused attention, that all improved beautifully as the time went on. So that's Bobby. I don't know if people need to stretch, need a minute, or I have two more cases to continue. Kavitha, do you have any thought? Should I just continue on?
Yes, Sujata, everyone is enjoying thoroughly.
Okay. So continue on. No one needs to. I'll just take
And
this.
if we run out of time or anything, questions also we can take it later. But please go ahead.
Yeah. Okay. Thank you. All right. So we did a case of Belladonna from a plant kingdom. We did a case of Mercurius, and then we did a case of Lac-Loxodonta. So now we are on to the case number 4, and this is James. So James came to me. He's one of the more timid, milder kids amongst compared to the 3 kids that we talked about. The background issue was birth trauma. It was, I think he ended up having the epidural. Mom had epidural and had a forceps delivery, and there was definitely issues with head being not engaged and hours, very, very hard, long labor. Symptoms are separation issues. He would cry, needed mom, tremendous anxiety, lots of ear infections, rubbing continuous rubbing in his ears, boring fingers is one of the repertory rubric that we have. Gastrointestinal issues. I think he had a H1N1 vaccination, and after that, so there was H1N1 flu going on at that time, and he got a vaccination, and after that is when the autism came to be diagnosed. And he also had spinning obsession, but that was more related to the washing machine, not twirling like we saw in Lac-Loxodonta case. So the ear infections began, and treatment, medications, antibiotics for that began right on. First ear infection was at 3 months. He started getting night terrors around nine months. The diaper rashes began about a year and a half, and those were some of the symptoms. So what I saw, and the way he was so timid and hiding behind mom, you can say hiding behind mom's skirt, clingy to her, separation issues, tremendous social anxiety. He also brought his blanket with him. He had his stuffed animal with him when he came. I mean, he's 4, so it's fine to have those, but it's a little bit, you look at those like, they had driven for an hour and a half to come and see me, and, having the security things, so you just know that there is an attachment that's going on here. Fear of downward motion when he was a baby, and now mom said, the issues are in the elevator, not so much on the slides anymore, but much more in the elevator. He doesn't like that. He was stuck in a birth canal for a while. I think it was a 18-hour or some, long delivery. He loves to spin. And actually, that was very interesting because he would spin, would not get dizzy. Then he would ask his mom to spin with him too. And within seconds, mom would get dizzy and say that I have to stop. But he would continue spinning. I did observe putting fingers in ears, and at that time, not necessarily he had a ear infection. And mom said with ear infection, it gets much, much more. Diaper rashes, rashes behind the ears, yeast overgrowth, mostly diarrhea for him. And then he will not go potty anywhere but at home. So he has to come home to go potty, even at that young age. Loves imaginary play, but at that time, mom said he lacks creativity. And I'll have to tell you, after now I'm seeing he's a middle schooler, and I'm seeing him now after 8, 10 years, or maybe 6 years, 7, 8 years. And the remedy I'm giving him is he's so creative, and he returned. I think during COVID, what happened is people started coming back, and I have lots of returning clients, and he is one of them. And the remedy I'm actually giving him now is rubidium, because he is so creative and he makes movies, and his imagination is enormous. But at that time, when I saw him at 4, he lacked creativity. This was all what he could draw at age 4, just basically pencil, putting little few things on the this is his doodle. And you remember at 6-year-old, the Belladonna kid, what he drew compared to James's drawing. Of course, there's a 2 years difference, and lots happens in the 2 years, but I thought you would like to see. The doodles really give, doodles and dreams or terrors, those kinds of things give us a idea of what's happening in the subconscious. So nothing big in the repertorization. Again, it's a radar opus synthesis repertory. Timidity in children, clinging persons and furniture too, because the clinging in children has only 10 remedies, and clinging persons or furniture to has 11. I just decided to take both. It's not well represented in rubric. Fear of downward motion with the elevator, that's happening now, and then observation, fingers boring in. And you can see, of course, silica was definitely one of the remedies I was thinking about. So was burrita carb. And I did give him burrita carb up to 10 m before I ended seeing him after a year or two. That was the last remedy I gave him. So all the 3 remedies, the first 3 remedies were good remedies, but I decided to start him on borax. And the reason of this, boring fingers and the clincher for me, of course, was the downward motion, whereas silica is not so prominent in the downward motion. Of course, you see that it's in the rubric, it has 1 mark, but that and boring fingers also, I just thought, and again, silica has that too. I chose borax. Here's the improvements over the next few months. Speech, communication improved, social skills improved, which was very interesting that every kid that I have presented, and as they improve, and in general in my practice, if they're on the spectrum, their social skills improve. They know how they fit in. Actually, I have a client, 6-year-old who I am seeing, who I gave Krypton recently. And with the first follow-up that I did for him, that's what his mom said is, before now he goes, runs in his preschool or kindergarten. Well, actually he's entering kindergarten this year, but he runs in the, gives hug to a teacher, and then knows what to do with the other kids. So I think this improvement in the social skills is a important one that happens as the kids improve in their abilities, and the remedy gives the gentle stimulus needed for the vital force to balance out the imbalances. It's not that separation issues were gone, but he was much easier separating from mom. His fears improved, his of the elevator and all that. Nothing necessarily gone, but over the time, he became much more comfortable in elevators. His attention got better, and the stimming that he was doing went away. The other improvements were in his digestion and his appetite. Oh, and another thing in this case was bedwetting, and that went away. So in 2019, I had called mom before preparing a presentation for another seminar. And this is, I asked her if I can just go ahead and get one of the drawings he has done. And this is the one she sent. So he is like creative, very, very creative. You can see from the dots of the pencils to this, you get a little reflection, and how detailed he is, how things kind of, make sense, and what his imagination. And he actually creates stories and writes stories and then tapes himself. Dogman and Bowtie, I think it's some movie or some TV show that he's interested in. So that's our borax improvement. I have not written down, but before I ended towards the 1.5 2-year point, I did end up giving him Borida carb, because even though social skills improved, they were not gone, and Borida carb really helped further. And he was also one of the kids that I gave some of the intercurrent remedies. And the one that I gave him during the acute, also I gave him some remedy, and then intercurrent remedy was merorinum for him, because he had strong cravings for the citrus fruits and icy cold. Now let's go into, so we saw 4 boys. Let's go to Anne. When I saw Anne, she was 6. She had seen another homeopath since she was diagnosed with autism, and the remedy she had received was Calcarea carbonicum. And the symptoms, so you can see from what I'm going to narrate now how Calcarea carb was not a bad remedy at all, and she had shown improvement, but not as much improvement as you will see that we saw after argon, which was the remedy given to Anne. So slowing down, slowness in everything, kind of almost one would feel unmotivated, a little lethargy, passivity. Mom called her as she was a duct tape baby. She hugs and just likes to cuddle, and once she is in the, in the hugs, that's what where she wants to say. That's why she was called duct tape baby. Yeah, she loves to hear stories when she was a baby. And distended, hard abdomen. That was another thing that was very prominent, which never resolved. Some of the things had gotten better with calcarb, but this distended abdomen and constipation did not. And then before she saw me, there was molluscum contagiosum symptoms that had popped up. Here are study themes: lazy, lethargic, sluggish. And so sluggishness on all levels: lazy bowels, slowness is movement, slow to talk. So again, Dr. Sankaran calls this Local becomes general, not in one area, but it's in the abdomen as well as in the movements, as well as in the verbal abilities. And she's 6. And so Anne was one of those people who was able to say my name, Sujata. She was able to hug me. So she was on the spectrum, and she has improved with calcarb from her previous, when she was previously diagnosed with autism. There were improvements for sure. And she looked at me in the eye, she smiled at me, and she was playing video games during the on the arts, different arts. There were some video games that mom had, and she was quiet and sitting in the chair and, happy. So weakness, one of the symptoms that was, yeah, it's someone. Okay. Thank you for muting yourself. Um, no energy to suckle as a baby. The sense of like inner contentment, that was, as for a 6-year baby, even though we're seeing slowness and all that, but as a homeopath, we're really energetically tuning with what's going on. And as we advance in homeopathy, those skills get honed up. And so I was noticing this inner contentment. And remember, this becomes important when we do differential diagnosis. And because I gave her a noble gas, I just want to bring to your attention that the contentment is of the state she is in. And I did definitely observe that. So she loves issues of nourishment, always interested in hugs, stories of when she was a baby, showing pictures of her when she was a baby, and strong need to connect. Mom says hugs, hugs, and more hugs, connection and caring. Now, this is important again in the differential diagnosis, because what role are we looking at, right? So this is a role of that needs affection, So just kind of, knowing, that the remedy was argon, so it's a row 2, and it's definitely these symptoms are part of the remedy picture. She also had fear of tunnels, loud noises. These kids have these tunnels that they go through, and her sister used to love it, but not her. Loud noises, and she also did not like fluorescent toys that glow. Now that was another interesting thing to note, that argon gas is quite fluorescent. So here's our argon baby. Issues around nourishment, connection, caring. That's the, did I say? I don't know. Row 3, insecurities, contentment, and aspects of the row 4, because row 3 ends, argon is at the end of row 3, and then the row 4, which is the Kali row, weakness, lack of motivation, calcaria is the second column. Anything new is hard, as it is the change. So here's the picture of, we have row 1, helium, row 2, neon, row 3, argon, noble gas of row 3, krypton is row 4, and xenon is what did I miss? Xenon is row 5, and then radon is the row 6. At sensation level, noble gases are structurally complete, as they have 8 electrons in their outer shell. So the contentment, they don't need to strive. They don't, in the left side of the periodic table, you see a lot of striving, wanting to be better, more. And then on the right side of the periodic table, you see this more degeneration or downwards thing, or, less interest in the striving. And in noble gas, it's the equanimity, the contentment. No longer in search of another electron in order to feel complete, so they stay inert and non-reactive. And to the world outside may look like, they are not progressing. And so, as I mentioned, I observed discontentment. So here's the remedy response. She has become independent. I can do it myself. She has toilet independence. Before, she would not, she had no interest in complete potty training and wiping herself after a bowel movement, and all that came came after Argon. Initiation and planning of action. Before, she would not be interested in planning anything, or what the family is doing, or now she started having her opinions, and she started initiating having friends over for play dates, or neighborhood kids. Purpose. So now mom's observed that she was having purposeful hugs. So now it wasn't just hugs for the sake of hugs, and not, she was receiving the hugs, she was feeling the touch, and she communicates through love, and speech declined after 2 weeks. And this is what mom said. A week after remedy, her speech was quite amazing. She wanted to explore and experiment, and her molluscum contagiosum is mostly gone, except one large one still remained. So I'd started her on Argon 30C. I gave her 5-cup method. Those of you who follow Dr. Farooq Master, he does the 5-cup method. I can explain more about how to do that, but you can also watch the YouTube video of what the 5-cup method is. And I had just asked her to take 1 teaspoon twice every week. And as the lower potency, as intensity of symptoms, she was not bad with carbs. So there wasn't need to go too high in this case, is what I felt. And the underlying miasm I saw was avoidance, and so the psychotic miasm. So that's why the repeated doses. Then mom said that in terms of her accomplishment, making appropriate jokes, accomplishing tasks with ease, her new self is coming out, decision to take her off. So she was on various supplements, and mom said, now I would never have dreamed of taking her off of the supplements, especially the constipation related issues. And because she was doing better, that mom decided to take her off. Here's follow-ups in 2013. Anne shows her own interest. She has a creative pursuits. She has a ton of energy when doing something which she very much lacked in the beginning. Wants to give hugs and still loves to snuggle. She learned how to swim. They had tried to have her sister and her swimming, but Anne was never very interested, much more afraid of water, and now she started swimming, and actually she won a dance competition. And her sister, who was just actually a year and a half younger than her, now Anne can outpace and outrun her sister. And here's the Anne's portrait, self-portrait. And this is after the remedy. So this is the end of my, and we can start questions, answers, or I can go into any of the cases, a little more details. But just wanted to say, may the learning from this presentation assist you in your mission to create and restore health. And I love this Paulo Coelho's thing in The Alchemist. When you want something, all the universe conspires in helping you to achieve it. So as homeopaths, may the universe conspire behind you and with you in helping you to achieve the best of homeopathy has to offer to the world. So that's it, Kavitha. What else can I say or answer?
Thank you so much, Dr. Sujata, for sharing this fabulous information, and especially treating successfully autism. And the presentation was carefully prepared so well, covering all the remedies, plant, animal, mineral remedies. It's wonderful. And we will take some questions. Dr. Sweta, please.
Yes, ma'am. We have one question, ma'am, from Dr. Robin Pollock. Please explain more fully why you chose Locks A, other than the twirling of the trunk is similar to the twirling of the scarf.
Okay, can I see the question in the chat? Let me just quickly look at it. Okay, so um, where is Robin's question? Hi, Robin, by the way, thanks for a question. I'm trying to understand the exact question. I don't think I fully understand. So let me see.
I have just posted it, ma'am.
Okay, perfect. So more fully, why you chose Lactloxodonta other than the twirling of the trunk. Okay. So here's the thing, Robin. So we're really so one is the watching of the Dumbo movie. One is the larger size of him. So, really muscular, robust kid. We're putting all this together, and the clincher was his father, biological father, being a crane operator, again, heavy objects. Another thing I'm going to say is the matriarch, connection with the stepmom. The animal kingdom came through very strongly. And this is a great question because we don't have enough information. And I was also, autistic kids are gifted and have something that they are trying to relate to us. And that's why, as earlier on, I said that really paying attention to what they are doing and what they are conveying is as important as the parents' information and is as important as the observations that we are doing. So this kid, I had 12 different Disney movies all in this entertainment center. And starting with the first 5 minutes, he just went to the entertainment center, pulled out Dumbo, and he played that. And of course, at that time, the first session, when I chose Lackloxodon, I didn't know this, but that was the movie he played the entire 6, 7, 8 follow-ups. And I would try to hide it. I would put it behind. I would, but he would go after that. So to me, that's the thing that kind of became bigger. But animal kingdom theme of the neglect, abuse, and the stepmom's energy about him, about her in, like her, me versus the biological mom, like how bad and biological mom was really not a good functioning mom. We can clearly see that. The other thing is the the need to escape and need for affection, both. You see in the mammals, right? You see this need to belong to the group, and you see that. And his connect, and then matriarchal, the lineage always in the elephants, they're all matriarchal. The elephants, mom elephant is the in charge of everything, decides everything. So you can see the passive role of the dad. He's of course showing the energy of the elephants with the heavy operations and crane and accuracy and carrying heavy objects and those kinds of things that come through the crane operation. So put all those things together, and really, Robin, what helps is, like, just like I showed you the case and describing Lackloxodonta, seeing cases as a homeopath or knowing successful cases along with the provings and reading the provings thoroughly from the master provers are the two ways that we can connect these less represented remedies. And this was a case that was so successful. And also remember the child who tried to escape and hid in this old woman's house. And when the people came, social services and everyone came to find him, he tried to attack them. So now that's the energy of an animal. Even though he is gentle and noble, again, coming back to stepmom's description, the gentle, noble. So all these things came together for me to come up with the lac-loxodonta. So it wasn't one single thing, but I hope that answers your question. Oh,
One
where
more
can we read the Materia Medica of lac-loxodonta? Great. So the proving was done by Nancy Herrick she taught at the Hanneman School in California. And the name of the book is Animal Minds. And Animal Minds and something voices, human voices, something like that, or Animal Minds, Human Voices. Do you want me to go on internet and quickly find that book? I'll just put that up in the chat. Give me a second. Okay, animal.
I think Liz has mentioned, Sujata, in the reference works also it is there, the proving.
Is it? Okay, perfect. So here, am I still sharing oh, here it is, Animal Mind, Human Voices. I can put that copy image and bring it into the chat, and for everyone, Control V. Let's see if it does allow me. Nope, it does not. Animal Mind, Human Voices by Nancy Herrick. And as Kavitha just said, also in reference works. There you go.
Thank you, ma'am, for sharing the name of the book. And there is one more question from Dr. Dingri. Is the ratio of males who suffer autism more than females?
Yes, absolutely. Yes. And the connection with moms being on antidepressants is also well known. And the connection with the gastrointestinal, the gluten and all the sensitivities. So these kids do improve rapidly once once the overload that happens that's going on into their food, when that's taken away, they improve much more so.
All right, this is all about the questions, and thank you so much, ma'am, for patiently answering all the questions.
Oh,
Thank you.
my pleasure.
Over to you, ma'am.
Thank
Dr.
you,
Kavitha.
Dr. Sweta. I know many of them have many questions since we are running out of time and it is 10:30 past 10:30 midnight, not midnight, night in the India and other places. We have Professor Rechna, please. If you would like to speak few words.
Yes, please. Congratulations, Dr. Sujata. It was a wonderful webinar. My question is, have you tried carcinosim 30CH and for energetic hyperactivity autism child stramonium 6C?
Well, of course, based on the matching symptoms. I'm not biased about using any single remedy for a particular condition, but if someone needs it, certainly. And carcinosin is an amazing remedy, and can help tremendously in the situation also. Whereas stramonium, you have to see that state of stramonium, then I have no problem giving stramonium. So everything has to fit into the symptomatology of the client that we're seeing. So don't be biased. Don't be partial to the remedy. First, take my suggestion, and what has been successful is take the full case, unbiased, unprejudiced, just like, that's our aphorism from the Organon, right? Go with the unprejudiced open mind. So when people, the moms want to tell me if they have seen previous homeopaths and they want to tell me, oh, the names of the remedy, I say, no, not the first few months. Let me just observe, because, if then even just knowing it, so like, I'm glad I didn't know that Anne was on calc carb. I came to find out later on because it made sense to be given calcarb. But I want to just go in, I want to receive the child, receive the state, receive all the information, do my own analysis, and then get the history if they want to share. Does that make sense, Regina?
Yes, thank you very much. Many blessings to you. Congratulations. Back at you, Dr. Kavitha.
you, Professor Regina. And from the study group team, just one question. If anyone wants to say, please.
There is one question from Lisa that I would like to, oh, Lisa, I would like to, it's in the chat. Do you find that with autistic children more than non-spectrum kids, that these children reflect the family dynamic structure even more? Wow. Oh, that's profound. To a certain extent, yes. Yes. But the way you use a little different words, but the way I see it is they have some information at some higher vibration and level that those of us who are fully in the world don't have that capacity. It's definitely what I have seen. They operate at a different level. And that's why I think it becomes even more important to observe what is their language, what are they saying, what is going on in the session, what is this about flipping light off as soon as you enter in, what is this about the timers. I mean, it's monomania, it's the fixations, it's ritualistic behavior. But if you look at Belladonna and Mercurius, how different their way of what they were trying to tell us. You know, each kid was so individualized. And this is the beauty of our homeopathy. You can have treating hundreds of people with the same diagnosis, but each one has such a strong personality and picture that we have to look at, understand, and then match that. How many months we will have to wait to change the remedy? If you're not, oh, this is from Purnima. Well, there are various ways how you want to, when you want to change the remedy. So you're talking about all the rules that we have for second prescription. So first, you have to see yourself that the child is not improving. That has to be your assessment as a homeopath. You have to make sure that, like, let's say in the case of borax, the kid that gave borax and then went to Burita Carb, his improvements were great, but the reason to go to Burita Carb was his timidity in the social public places. And the way he looked, his attention was better. He knew who I was. He was talking better, but there was still this Burita Carb handicapped element that was still continuing in his looks, and his timidity in the social situation was continuing. So with that assessment, after staying on borax for a year and a half, I don't exactly remember, sorry if that's not the correct time, but whatever, 2 years or 3 years, then I decided to change to Burita Carb. And that helped. And then I didn't see him, he didn't come back until recently for different reasons. Oh, someone is saying here, oh, Lisa, you're very correct. They're in both realms and act as a bridge. That is so true. Very nice observation and comment. Purnima, we can talk about second prescription, if you, or just go to Roberts. I think Roberts has written beautiful information on second prescription, and George Vitolkas. Yeah, understanding, there's like there's drawings by George Vitolkas is what I remember, how to do the second prescription. And it's amazing information. like there are times like if you see this reaction, I think and it's all on my at my in my office desk just now, and I'm not at the office right now, but it clearly shows what's happening, what's the remedy response, and what that means. So find George Vitolkas's remedy responses and second prescription information. I would say that would be very helpful to decide how long to wait and watch. I mean, I have no problem waiting and watching if the remedy is right, and but there is a slow, steady improvement. I don't have to see dramatic improvement. It always helps if everyone is saying he's doing better. The teachers at home, college, school are saying he's doing better, and that's great. But it doesn't have to. We're not going to get always those responses. And when we show successful cases, these are 5 of my best autistic cases that I'm showing. Talk about the different cases that still are challenging or are still in the process. So it's a whole different ballpark. Practicing homeopathy is amazing, skillful, and we get to learn from our gifted clients as well as our teachers, and participate in the webinars like this where the teaching is crucial, and the impact that it can have on the world by bringing solid, good classical homeopathy is what my mission is. My mission and calling and my legend, personal legend, is to create a world of vibrant health by using my gifts through art and science of homeopathy. And may you find yours.
And we will bring you back, Sujata, again at our webinars. Since we are running out of time, we were just, and if anyone has any more questions, please email us to castedgroup@gmail.com. And it's a wonderful, Dr. Sujata, especially so many things, new remedies. And when you said Nancy Herrick's lack loxodonta, I have some questions which through your this webinar, it was so much clear, and many tips, and also about the impossible cure from Amy Lansky. It's a wonderful book. So so much we have learned in this today's session, and we'll bring you back again because this topic is huge, ADHD. And to tell you, Apis mellifica has transformed a child who, when he was in high school, and last week, his mother said like he's good getting married, and that is such a beautiful cures from homeopathy. That's a wonderful. And thank you so much once again, Dr. Sujata, for sharing your immense knowledge and gracious presence at today's webinar. And we would like to take privilege to honor your precious time. And with a car certificate, please kindly accept from our team. Dr. Sweta.
That is beautiful. Thank you so much. And all what I have to say is see you at next weekend at JHC. I will be presenting, and so will be many of you, and would love to learn more.
Definitely. And Dr. Sujata will just announce our upcoming events. So on May 9th, we have Ambika Waters Life Energy Medicine on topic healing and health with homeopathic color and sound remedies, and Imponderabilium. And on May 16th, a unique opportunity of Q&A question session with homeopath Misha Norland from England on topic that which cannot be explained by the old scientific paradigm. So we have many more renowned homeopaths lined up for our CA webinars. And again, do not miss the great opportunity of JHC conference, which is on April 23rd to 25th. So registration ends tomorrow. Please register at www.jhc.info. And to become NCH member, when you enter $10 discount, Kavitha 2021 coupon, you get $10 discount. I always thank Ka Homeopathy Study Group entire team for the continuous support. And today at our webinar, we have many people like Dr. Ka volunteers like Dr. Hira Agarwal, Dr. Mamata, Dr. Nupursha, Dr. Stravani, Dr. Uma. Everyone we appreciate so much. And also the participants from different parts of the world, India, USA, New Zealand, Switzerland, South America, Australia, and many more countries. So thank you all for your presence and undivided attention. And we always honor the past, the pandemic crisis, and thank universe and all the dignitaries of part speakers of our webinars. And Dr. Sweta, would you like to say anything, please?
First of all, I want to thank Dr. Sujata Owens for her gracious presence and for this wonderful, enlightening session with us. And thank you all the viewers for joining us today. And for the recordings of all the webinars, you can subscribe our YouTube channel with the name Kavitha Kukunoor. You can follow our social media platforms with the name Ka Homeopathy Study Group for all the updated information for all the future webinars and for all the recordings there. And thank you all for joining us and showing love to us. And thanks a lot, all of you.
Thank you, Dr. Sweta and Professor Regina. Before we end, anything?
Cheers. That was a wonderful and amazing webinar. Great to look forward to new meetings to learn more from you guys. Congratulations and many blessings your way. Namaskarams.
So
Back
much.
at you.
And Dr. Sujata, would you like to say anything before we wrap and see you again?
No, I'm just excited. You're doing such good work, and congratulations on receiving the recognition. I'm very proud of you and the work you're doing, and I am happy to be part of the KHA study group family.
That was wonderful. Thank you so much, Dr. Sujata and everyone. And see you all again at next webinar. Until then, stay healthy and happy. And Dr. Sweta will wrap the webinar.
Thank you so much.